is, like I said, is a very, very important topic. I just lost someone very close to me, a very close family friend. The last time I met you, I was telling you about this person, that she was on her last days. Well, she finally succumbed on Monday. There are people here that have cancer. What if they decided, you know what, they have given up on me? I think I'd want to go home. Is there any kind of services for these people?
There are actually. If they're here, and yeah, I must say that the Council General's office has been wonderful in facilitating the movement of certain patients, if they know, the families too. And what happens is, if they want to just to go home, our organization, the Belize Cancer Center Dengriga, will provide pain management for them. We do home visits for a selected number of patients. And the Belize Cancer Society has developed support groups in all of the districts that are very active. And with a referral of a name, go see Mrs. So-and-so, she's at home, she's at the end of life, see what you can do for her. They've been very, very good, particularly in the northern part of the country. And above.
That's nice to know.
They've been very good at supporting these patients until such time, and supporting mostly the families.
Okay.
Now, Blissful Sage Foundation has established over the last 2 or 3 years an office that will eventually become a hospice center. And the hospice center is to, in fact, address those patients at the end of life, providing respite care, providing items, patient care items like Pampers, providing care in like baths and so on in home. What they do is they support the families once the patient is at end of life. They will go in, they will help with the bathing and the feeding, and they will help the family to cope with some of the anxiety. They will provide certain oral medication if they have it, and that is all really to make sure that as the family goes through this very difficult period, that they have as much support as they need. The Belize Cancer Center in Dengriga provides nutritional support. I usually buy through, with my funds, things like Ensure. In Belize, if you go and you try to buy Ensure, it's like $4 a can.
It's a killer.
Okay, I buy 15 cases of Ensure for $71. And the only thing I have to do is, if anybody wants to help me, is to put it on a truck and send it to Belize.
Oh, really?
Yeah. But the patients, because they require nutritional support, and some of them get sores in their mouth, they can't eat. The typical food that you have acid or citrus in it it's like fire for them. So the Ensure is a more complete, it's liquid, it's easy to swallow, and for here it's easy to buy.
Exactly.
It's very easy to buy. So I would say that should a patient be here and wants to go home, if they can travel, they can refer them, and we will do their maintenance therapy until, because it's not curative anymore. It's simply sustaining them through end of life.
Okay. And some people just want to go home for their last day.
And we've had at least within the last 2 months 2 patients that we have facilitated that are being seen at the cancer center, and they're happy to be home.
Exactly. So that's the thing. They just want to go home and enjoy their last days.
Yes, very much so. And we're pleased that we are able to facilitate that process, because previous to 2008 it was not possible.
Well, thanks for your efforts. I mean, you deserve an applause for all your hard work.
Thank you.
I was talking to a friend of mine. Her husband, he's on his last treatment. Actually, he takes his last treatment this week. And she was telling me the only thing is that his energy level is so low. He doesn't want to do anything. I can imagine that is difficult, to just look at someone that you love just being there. What can you say about this?
Well, like I said, chemotherapy is a toxic drug.
Mhm.
And we live in an age now where we use a combination of drugs, to fight a certain type of cancer.
Mhm.
The body takes a while to bounce back.
Yes.
It doesn't come back just immediately.
Mhm.
The most important thing is to understand that he does not have the level of energy that he had when he started.
Yes, definitely.
He needs food to build his muscle. He needs protein. But more importantly, he needs a level of understanding that he will, until he gets to where he can do things for himself, and most of that is helping him to get past the fact that his life was impacted in such a way that a piece of it he had to give up. The things that he used to do,
Yes.
he now has to do slower.
Yeah.
And if she supports him through that process, eventually he will make a decision.
Back to where
He will make a decision. He may never get back to the same energy level that he was when he was sick, but he will at least feel good about himself and try.
Okay. All right. Then coming to the next question. I'm sure as people are watching out there, they hear about all that you've been doing and they are thinking, you know what, there's some way I can support. There's some way I can support the work that you're doing. How would you appeal to the listeners? When we come back, maybe you can tell us about some of the things that you need in order to continue running this operation.
Certainly.